Where for those who need to make a journey on the trains, there are severe delays on TfL rail services between Liverpool Street and Stratford. London Overground services are also suffering with severe delays between Stratford and Richmond and between Stratford and Clapham Junction. And on the Underground, there are severe delays on the Hammersmith and City Line. On the roads, there are queues on the A13 westbound to the North Circular Road junction after a car broke down earlier. Delays of about 15 minutes on the A10 southbound from Cheshunt to the M25 junction. Those restrictions are still in place on the junction roundabout.
This is LBC.
When you're
Ferrari now. 0345 6060 973. LBC.
if you're
Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
Gary says, I agree with extending the ban and the £5,000 fine. You should get behind it. You'd be the first to jump all over Matt Hancock and Boris Johnson if a third wave was to hit the UK in the autumn. Meanwhile, Tony takes a different view. The coronavirus goalposts are being moved yet again. Why bother with vaccinations any longer? All of which leads us neatly into the conversation with Health Secretary Matt Hancock, who joins me now. Thank you for coming on the show, Secretary of State. We will talk about, I know that there's a clinical research, a bulletin you want to give to my audience, and we certainly shall share that in a moment. But there is a degree of concern, some rather grim headlines. As of next week, people could be fined £5,000 to travel. Is that necessary? Good morning.
Good morning. How are you?
Well, I'm very well as you are. Since we spoke, I've had my first vaccination, and it is a testament to the great British scientists, the fantastic National Health Service, the brilliant British military who delivered it, and the army of volunteers who have worked in churches and car parks and goodness knows what else. Oh, and I suppose the odd politician as well. I ought to say thank you. Mr. Hancock, back to the question. Why do we need £5,000 fines? And thank you for asking.
Well, the thing is that at the moment, travelling abroad is not allowed under the stay-at-home rules. But from next Monday, the good news is that those stay-at-home rules are being lifted, and we'll be able to see, for instance, groups of 6 outdoors, in the park, in the garden, or 2 households. But as a result of lifting those stay-at-home rules, it's important to put in place rules to say you can't go abroad on holiday. That's part of the roadmap. That the earliest that will lift the restrictions on going abroad on holiday is the 17th of May, and that's because we can see, unfortunately, cases rising in our neighbours, and it's important that we protect the progress that we've made at home.
OK, but it says here, Secretary of State, holidays will be banned until the end of June, with people trying to leave the country facing £5,000 fines. Is that correct or incorrect?
That's not right. The legal framework that we're putting in place is until the end of June. That's because the roadmap as a whole completes, we hope, on the 21st of June, subject to the data and checking that progress is going well on those steps. The international travel restrictions are part of step 3, which we've said will come in not before the 17th of May. So that isn't changed, and this is just how we're putting that into law.
Sorry, so what is the framework that stays in, you said until June? So the travel ban is not part of that framework?
Yeah, so we're having a vote in Parliament on Thursday on the so-called roadmap regulations. They are the regulations that underpin the roadmap as the route out of the pandemic. And the roadmap is due to end, should the data support that, on the 21st of June. And so just after that, that's when this whole legal system will disappear, let's hope.
Right.
That is our plan.
OK.
And within that, the international travel restrictions will come to an end no earlier than the 17th of May, subject again to the data. And that isn't changed. I'm glad for the chance.
OK. Do you think Brits will be travelling overseas in July for holidays?
Well, we don't know. We don't know. This decision ahead of the 17th of May will ask absolutely that question. And we have a structure in place called the Global Travel Task Force to come to a conclusion on this. But we've got to protect this country and the progress that we've made. But at the same time, I totally understand that lots of people want to travel abroad this summer, especially after the year we've all had.
Indeed. Now, Lord Bethell, one of your colleagues, said that the whole of Europe could be added to the red list. How real a possibility is that, Secretary of State?
Well, we don't have any plans to do that. We do have this red list and the amber list, and at the moment that is working well. And so we don't have plans to do that. But
why did he say that in the House of Lords then, Secretary of State?
Well, I think if you look at the entire context of what he said, it makes it very clear. He was being asked to do that, and we don't rule it out, but we don't have plans to do that now.
All right. Just talking about a couple of other targets, the government's target of ensuring every adult will have a first jab by July. Are we still on target for that target, Secretary of State?
Yes, we are. I mean, we've seen the challenges in supply, and it's a constant work to make sure that we have enough supply. The NHS has demonstrated that it can deliver really huge numbers. We saw over the weekend on Saturday, we saw 844,000 people get a jab, which is absolutely remarkable. So the ability to deliver the jabs is there. It's all about the supply. But we are currently on track, yes, to be able to offer a first dose to everybody, every adult, I should say, by the end of July, yes.
And the follow-up within 12 weeks thereafter?
Yes.
And on target for that as well?
Yes.
OK. Now, I know you're keen to talk about a vision for clinical research, Secretary of State. What does that mean? More importantly, what does it mean for my listeners?
Well, what it means for your listeners is that because of a combination of our scientific prowess and our NHS and the government funding and the seriously impressive companies that we have in this space, we've been able to develop things like the vaccine, but also treatments for COVID. And we've discovered that dexamethasone, which is the most important treatment for COVID when you end up in hospital, has saved 22,000 lives. And that was discovered in the UK. This is all part of the response, is, making sure that we use science as much as possible to get us out of it. And ultimately, with the vaccination programme, that's what we'll be doing.
OK, so we look forward to that. A couple of other stories to get your input on. There is a possibility, we read, that care home staff will effectively be mandated to have the vaccination. Can you confirm that to be a fact, Secretary of State?
Well, again, on this one, no decision's been taken, but it is something that we're looking at because, people who are looking after elderly residents in care homes, who we know to be the most vulnerable to COVID, they have a duty of care not to pass on the disease, and it's a reasonable question, and many care homes.
Well, what do you think? You're Secretary of State for Health. I would imagine you'd be in support, wouldn't you?
Well, we're considering this, and many care homes have asked us to do it. There's a legal change that's required, as you can see, I'm open to that, but no final decision has been taken.
So how will that do? I mean, it seems strange. You're able to decide to fine people £5,000 if they go overseas like that, but you can't make a decision about care home staff. Why is it taking so long?
This does require a change in the law, so we'd need to. We need to do that. We need to talk to more people who work in the sector.
Talk to more people. What sort of people?
The sort of people who would have to be vaccinated. Now,
you're going to talk to them all first. That's going to take a while. I mean, how big a problem have we got, Mr. Hancock? What is the percentage of care home staff? How high is the percentage? It's obviously giving you and your colleagues concern.
Well, thus far, 76% of staff in elderly care homes have been vaccinated, and over 90% of residents. But I want both of those figures to be higher. Now, one of the problems is that not every elderly resident can be vaccinated, sometimes for medical reasons, and we want to give them as much protection as possible. Now, 76% of staff having been vaccinated, that is good news, and that is good progress over the last few weeks. But there's still further to go.
All right. What can you tell us about the state of play between the United Kingdom and the European Union over the supply of vaccines between the two countries? It was reported that the Prime Minister has been lobbying some European leaders. What progress do you understand he's making?
Well, I think the best thing to say, Nick, is that this vaccine programme ultimately is an international programme, and it is best to work constructively internationally. That's the approach that we've taken throughout. And, these vaccines are manufactured internationally. We're working with American colleagues, we're working with colleagues on the continent, we're working with colleagues in India to develop these and manufacture these vaccines as quickly as possible. I think that approach, rather than throwing up borders, is the right thing, because that's the way we're going to protect as many people as possible, as quickly as possible.
Lastly, I've lost count of the number of times you and I have spoken over the last 12 months. You'll be aware, of course, of the significance of today's date, also aware that you've suffered and survived the virus. What's your abiding memory of the last 12 months, Mr. Hancock?
Gosh, well, there's so many extremes of emotions, Nick. There's some very difficult times. I've lost members of my own family. I've had the disease myself. But then there's also moments of great joy. The moment that Lord Bethel, who you were asking me about earlier, came and told me that the vaccine worked. That moment, and the moment I saw Margaret Keenan being vaccinated, that was pretty good. And so it's been highs and lows. And one of the things I think we've got to make sure we capture in all the debate we'll have, quite rightly, afterwards about what we could do better, we've absolutely got to focus also on what went well and learn from that too. And the vaccine programme is so important. It can teach us how to get stuff done in government in future because of the approach that we took.
Grateful for your time and for the preceding 12 months. Be well. Thank you. Health Secretary Matt Hancock appearing here on LBC. 1 minute after 8, the news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, Boris Johnson has praised the UK's great spirit exactly a year since he first placed the country in lockdown. A minute's silence will be